Well, time now for our mental health moment of the week. Maine's mental health safety net is facing a high-stakes funding cliff. Well, the National Certified Community Behavioral Health Clinic, or CCBHC model, has helped to expand access to care. The initial federal money is drying up, and as Washington shifts the financial responsibility to the states, the sustainability of this mental health urgent care now really rests with lawmakers. And here with us to discuss is Sweetser's CFO John McAnuff. John, thank you so much for being here. Yeah, we appreciate it. So first, what's been the impact of this program on Maine adults and children?
Megan, the impact has been profound.
Yeah.
Sweetser operates three Hope and Healing centers throughout the state, one in Lewiston, one in Brunswick, and one in Sanford. And our Hope and Healing centers are part of the national CCBHC model, which is the gold standard for the delivery of behavioral health care. The beauty of the CCBHC model is access. So you can come into any of our centers and receive same-day care regardless of your ability to pay and without an appointment. So we think about it as urgent care for your mental health. And so you can come into any of our centers and receive any kind of service that you can think of. You can get medication management or therapy or substance use treatment, care coordination, you name it, all under one roof.
Okay, so for the layperson, for the person at home, what we're talking about is sustaining and keeping open these Hope and Healing centers.
Absolutely.
Okay, and so what would the pending legislation do if passed?
Sure, so this LD 721 would inject a prudent investment of $2 million to help sustain this service while leveraging $18 million of federal money. So this would help to keep in place what's already working so well. We serve statewide, all the CCBHCs serve 10,000 Mainers every single month, and there's a risk that that service could go away or be diminished.
So I would assume, that's why this funding is needed. We talk about how it's necessary to keep them going. What do you think would happen if they weren't?
Yeah, so we're already seeing an uptick in the people coming to us for uncompensated care. And so what we need is for this funding to help us to address that need, to keep people, vulnerable people, especially those that are underinsured or uninsured, keep them having access to care. Sweetser doesn't say no to anybody who approaches us for care. We help everybody, but not every organization can sustain unlimited uncompensated care. Sweetser alone provides more than $1 million a year in free care, and we're very proud of that.
Yeah, and so if anyone at home, any of our viewers want to help, how can they do that?
So the number one thing, so there's really good news about this bill. It has wide support, but that's bipartisan. And so what we're asking for is for legislators to please include this in the budget package that's coming up, and for the folks at home to reach out and tell your legislators that this is something you want to see funded so that people can get the care that they deserve.
Yeah, so important to keep it funded, to keep it in these communities.
Absolutely,
yeah.
Especially it's working so well.
Yeah, exactly. Okay, John, thank you so much for joining us. I'm glad we could get that out to our viewers.
Megan, thank you so much
we
for the
appreciate
opportunity.
it. Okay.